The City Centre for Human Reproduction has been operating since 1987. It's a unique organisation that provides a range of world-class healthcare services in reproductive health. The centre's main goal is to provide affordable, high-quality and specialised medical care in gynecology, andrology and genetics. The centre provides treatment for patients with impaired reproductive function and a full range of healthcare to gynecological patients. We also cater for adolescents and children's reproductive health. The centre's priority is prenatal diagnosis of congenital malformations and hereditary diseases through screening. The specialists at the City Centre for Human Reproduction help solve a number of family problems. The results of their work depend greatly on mutual understanding between doctor and patient. The centre is equipped with the latest technology from leading manufacturers, the use of endoscopic methods of treatment, and the active introduction of new reproductive technologies have given hope to every woman to become a mother. Our highly qualified doctors are dedicated and care deeply about their patients. The centre's main aim is to ensure a healthy baby is born to every family.
The protection of the reproductive health of the Republic of Kazakhstan's population is a vital national goal. And it's not just families, but also the state and society as a whole that's interested in bringing healthy children into the world.
For over 28 years, the centre has been one of the foremost clinics in Kazakhstan for reproductive health. The City Centre for Human Reproduction includes the following outpatient departments: Clinic, Marriage and Family Department, Department for Ultrasound Diagnostics, Medical and Genetic Counselling, Hospital, Obstetric and Gynecological Department on a budgetary basis, Paid Services Department, Clinical Diagnostic Laboratory. The centre has created all the right conditions for inpatient treatment, cosy wards, treatment rooms, a modern laboratory and a fully equipped operating theatre. The range of medical services include medical and genetic counselling, including prenatal screening of pregnant women, invasive methods of diagnostics of hereditary diseases in fetuses, chorion biopsy, placentocentesis, amniocentesis, expert ultrasonography in obstetrics and gynecology, family planning, reproductive health care. The centre's specialists put every effort, knowledge and expertise into the treatment of male and female infertility, treatment of miscarriage, gynecological endocrinology, pediatric and adolescent gynecology, urological andrology. Every year we perform a vast amount of laparoscopic and reconstructive genital plastic surgery. Treatment of pregnant women up to 22 weeks who have complications. We do laboratory studies into blood hormones, infections, sexually transmitted infections, clinical blood and urine tests, biochemical and genetic studies, cytogenic studies. The centre is equipped with the most modern and advanced equipment from the best manufacturers. The centre boasts highly qualified personnel trained in leading clinics in Kazakhstan, Russia, Ukraine, Belarus, Israel and Korea. The centre treats more than 500 visitors a day. Who are the City Centre for Human Reproduction's clients? Childless couples who would like to conceive and give birth to a child, women in need of gynecological help, men with urogenital diseases, children in need of gynecological and urological care, families in need of medical and genetic advice, pregnant women who need to be screened for congenital malformations and hereditary diseases in the fetus.
The City Centre for Human Reproduction is developing rapidly and moving forward in tune with the times. Annually, our centre is expanding the number of ongoing studies, increasing its number of medical services and providing significant educational outreach on protection of reproductive health.
Today, infertility is a major problem faced by 25% of our city's population. That's every fourth couple, and it requires a qualified and timely approach. Over the past 10 years, advances in reproductive technology have achieved more diverse and affordable infertility treatments. The method used depends on the causes of infertility and health status. Many couples planning to become parents come to our centre to prepare for pregnancy. One of the key directions of the centre is prenatal diagnostics of congenital malformations and hereditary diseases of the fetus. The Marriage and Family Department is part of the City Centre for Human Reproduction, where highly qualified doctors give counselling and treatment for the following types of diseases: treatment of reproductive system diseases, treatment of sexually transmitted diseases, treatment of infertility for both men and women, treatment of miscarriage, advice on safe and effective protection against unintended pregnancy, access to and selection of safe methods and means of contraception, advice on safe abortion. Our centre has the city's only facility providing for the reproductive health of children and underage adolescents. We have a specialist child gynecologist and a urologist andrologist for teenage boys. The most common appointments with the children's gynecologist concern ovarian menstrual cycle failure and inflammatory diseases of pelvic organs.
Reproductive health is a state of complete physical, mental and social well-being, not merely the absence of disease in the reproductive system. The rate of infertile marriages is growing every year. The number of women seeking medical help has increased from 15 to 35%. Infertility is the absence of pregnancy in a married couple after a year of regular sexual intercourse without using contraception. Infertility is not an irreversible condition. In the Marriage and Family Department, we provide advice and treatment to such patients. Our department has an ultrasound ward equipped with the latest equipment.
The Department for Ultrasound Diagnostics at the City Centre for Human Reproduction is Almaty's only prenatal screening department.
Since 2015, a single centre for prenatal screening has been functioning at the City Centre for Human Reproduction.
The department offers the following services: carrying out the first ultrasound screening at 11 to 14 weeks of pregnancy, carrying out the second ultrasound screening at 20 to 22 weeks, carrying out the third ultrasound screening at 32 to 34 weeks, ultrasonography of pelvic organs, ultrasound monitoring of follicles, ultrasonography during pregnancy in 3D and 4D modes, Doppler sonography during pregnancy, counsel of ultrasonography physicians for pregnant women with identified congenital malformations in the fetus, ultrasonography of the abdomen, ultrasonography of kidneys, ultrasonography of lacteal and thyroid glands. In addition, our ultrasonic equipment can give you a three-dimensional video image and record of your baby.
In 2005, a single prenatal screening centre was created at the City Centre for Human Reproduction for the timely diagnostics of congenital malformations and inherited diseases. In the Ultrasound Diagnostics Department, examinations are performed by experienced specialists with state-of-the-art equipment to provide an extended assessment and study of all organs and systems of the fetus using three-dimensional and four-dimensional image technology. Ultrasonography is the preferred diagnostic technique for medical examinations during pregnancy. It can be carried out repeatedly since it's not a source of ionizing radiation, so it's harmless to pregnant women and newborns.
The Medical and Genetic Counselling Department's speciality is the prevention of birth of children with congenital malformations and hereditary diseases. Reasons for contacting a genetic specialist are known or suspected hereditary disease in the family, kinship marriages, the impact of possible mutagens or teratogens before or during the first 3 months of pregnancy, significant deviation in the results of biochemical screening or marker serum proteins in pregnant women, identification of chromosomal markers of diseases and congenital malformations in the fetus during an ultrasound test.
Medical and genetic counselling at the City Centre for Human Reproduction seeks to prevent the birth of children with congenital malformations and hereditary diseases. A couple should see a geneticist to plan the birth of a healthy baby. The couple must optimise their health before pregnancy and take a course of vitamins. During pregnancy, a woman must undergo 3 ultrasound screenings, do a blood biochemistry sample and be sure to see a geneticist.
Today there are a number of questions and disputes surrounding invasive prenatal diagnostics, which include chorion biopsy, placentocentesis, chordocentesis and amniocentesis. Invasive prenatal diagnostics enable a definitive diagnosis of chromosomal disorder, provided norms and regulations for invasive diagnostics are strictly followed. The main risk of the above procedures is the threat of miscarriage, although small at 1 to 2%. Results obtained are extremely important for the prediction of the future health of the child.
Invasive prenatal diagnosis is performed by a specially trained and experienced gynecologist and an ultrasound physician. All procedures are carried out in sterile operating rooms under ultrasound surveillance, which minimises the risk of complications and totally eliminates the possibility of damage to the fetus.
The City Center for Human Reproduction is also one of Kazakhstan's first centers where blood sampling from mothers for non-invasive prenatal screening is done. The procedure can start from the 9th week of pregnancy. A non-invasive prenatal DNA test, used all over the world, is the most modern method for diagnosis of fetal chromosomal abnormalities. Accurate to 99%, it determines the chromosomal abnormalities of the fetus during pregnancy. All a pregnant woman has to do is a blood test. The Department of Paid Services of the City Center for Human Reproduction's wards includes 15 beds for inpatient care and 5 for day care. Admission to the hospital is either by doctor's referral or at request of patients. The department carries out all types of gynecological surgery, utilizing both traditional and endoscopic access, with the use of modern endoscopic video surgical equipment from leading German companies. We also treat inflammatory diseases of female genitals, miscarriage in early stages of pregnancy, and diagnosis and identification of causes of different types of infertility. Priority of the department is to perform organ-preserving surgery to maintain and restore female reproductive function. Our department employs highly qualified and experienced doctors who achieve great results in diagnostics and treatment. Our patients enjoy cozy wards and friendly care from highly qualified, attentive staff. High-tech treatment methods make it possible to shorten hospitalization to 1 to 3 days. The obstetric and gynecological department has 17 inpatient beds and 9 daycare beds. In accordance with the Republic of Kazakhstan's Code on People's Health and Healthcare System and a decree of the Kazakh government on the approved list of guaranteed amount of free medical care in 2015, the City Center for Human Reproduction provides free hospitalization for qualifying patients. Emergency medical care in the City Center for Human Reproduction is provided until 4 p.m.
Today, we have excellent staff and the technical facilities to allow us to provide medical help of any complexity related to our field. Since 2003, the centre has operated an endoscopic complex, laparoscopy and hysteroscopy equipment. The department successfully carries out complex gynecological operations with a small percentage of complications and conservative treatment of gynecological patients and pregnant women with threatened miscarriage and abortions in early pregnancy, and up to 22 weeks for medical genetic indications. Today, reproductive healthcare is a rapidly developing interdisciplinary field, bringing together doctors of different specialities: gynecologists, endocrinologists, embryologists, surgeons, andrologists, and psychologists.
Specially developed programs will provide every patient with an opportunity to choose the best medical care options in our center. The center's traditions, combined with the introduction of advanced Western practices in obstetrics and gynecology, mean patients with complex medical histories can be treated here.
We have a group of professionals who work for you and who are ready to answer your questions and tell you about the center's opportunities.
The City Center for Human Reproduction is located at Outpatient Department 124 Zhibek Zholi Street, Almaty, Inpatient Department 73 Tarakulov Street, Almaty. The City Center for Human Reproduction. We care for your future.